Well, hello, I am Shahadi Wright Joseph, and I am so thrilled to be participating in Conversations with Changemakers hosted by The Little Market. Now, for too long, there has been a health and a human rights crisis hidden in plain sight in the richest country in the world. Black pregnant women and new mothers are receiving inadequate health care and dying from preventable pregnancy-related causes at much, much higher rates than white women. I'm so honored to be talking about this very important issue with Angela Aina, who is the co-founder and executive director of the Black Mamas Matter Alliance.
Hi, thank you so much for having me today.
I am so happy to be talking to you. So first up, for anyone watching who doesn't know about the Black Mamas Matter Alliance, could you start by just explaining how BMMA got started and what it does?
Absolutely. Black Mamas Matter Alliance, we're a national network of community-based organizations, multidisciplinary professionals who are all Black women-led organizations that do the work of maternal health and reproductive health from a full spectrum. And a lot of the work that they do is very much rooted in what we call reproductive justice, birth justice, and the human rights framework. And how we really got started was out of a partnership between the Center for Reproductive Rights in New York and Sister Song, Women of Color for Reproductive Justice Collective here in Atlanta, Georgia. And they came together and developed a report back in 2014 that really showcased the reproductive injustices, especially around childbearing and pregnancy and even the postpartum period that a lot of women in the South in particularly were going through. And this came off of the heels of the report that came out of Amnesty International that really sounded the alarm back in 2010 that in the United States, the maternal mortality rate was increasing and had been increasing for the past 30 years. And so both organizations wanted to do a little bit more than just release a report, and especially since at the time it was gaining a lot of media attention. And so in 2015, they convened a group of Black women experts in the multiple fields, public health, medicine, academia, even in the advocacy space, to really think about what can we do more around this. And so a handful of us came together out of that to say, you know what, we need to have a national organization dedicated to this. And so in November of 2016, we became the Black Mamas Matter Alliance.
That's incredible. You know, my mom has always told me just about all of the things that Black women have had to go through, especially in the medical field. And, you know, that's always been kind of a worry for me, you know, becoming a Black woman. So this is very, very helpful for me to know. Now, next question, why do you think that the US needs organizations like Black Mamas Matter? I mean, surely we all have the medical technology and expertise that we need to make sure that no woman dies from preventable causes during pregnancy and childbirth.
Absolutely. Definitely, we need to exist. We found that we needed to exist, number one, because there was no other national organization or even national entity that specifically focused on what we've coined as Black maternal health. And more specifically, that any entity that was really rooted in understanding our traditional birthing practices and really centering the fact that really Black women and Black women of African descent have been practicing childbearing through midwifery practice for centuries, right?
Yeah.
That was also one of the root reasons why you know, during the institution of slavery, that was one of the main reasons why Black women were brought over here to help with, you know, with the process of catching babies. And so we feel like not only do we need to uplift our history, the very dark history around the atrocities rather that impacted Black women since the institution of slavery in this country, but then also uplift the fact that Black women have been doing this work for a very long time in our communities, and we have the solutions within our communities through our community-based organizations, through advocacy, through research, through care. Within the ways in which we do things through culturally congruent practices that needs more attention, it needs more support, more resources and investment to help combat maternal mortality and morbidity. And like you said, this is something that's very preventable, and we should not be going through this in the
Exactly.
United States. And most importantly, the fact that we spend over $111 billion annually in healthcare related to maternal and infant healthcare in the United States is even more of a reason why the fact that we have this ridiculous maternal mortality rate is crazy, and more of a reason why we need to diversify who gets to have these investments rather around the solutions to address this issue.
Exactly. I feel like this topic is just so needed because a lot of people, like even people in power, don't know about this, it's been said that like Black women are literally the most disrespected people on this planet. So I feel like this is so just informative to a lot of people. I love that. Next question. What do you want people watching this to know about why Black women are dying at such high rates, especially during pregnancy and birth?
Yeah, so just like you said, the fact that Black women are one of the most disrespected groups of people across the world, unfortunately. And a lot of that is just rooted in institutionalized racism, and then the fact that we've normalized white supremacy and white privilege and anything that seems to uphold that. And so therefore, it makes it seem like anything that's Black, anything that is of color, for some reason is deemed negative or othered. And so it's important that we even understand that those types of beliefs and biases shows up in how people actually practice medicine. Exactly. It actually shows up in our hospital institutions, even in our policies. We think about even the fact that Black women also experience a high rate of criminalization as it relates to pregnancy, in anything dealing with issues with parenting their children that they do have, which is really at the core of why we strongly believe that this work has to be rooted in reproductive justice. The other thing is that Black women have been experiencing what is called obstetric violence at a very alarming rate. So everything from being mistreated, everything from being not listened to by healthcare providers, even to being prematurely dismissed after childbirth and not being properly taken care of, or really monitoring any challenges or health issues that we have during the childbirth and postpartum period. These things are very vitally important. And when these forms of obstetric violence happens, this is why we end up dying. Perfect example, you would think that with all the resources in the world, highest educational attainment, that, some people think that it only impacts people of low income. No, we see the example of what happened to Serena Williams, the fact that she had to like advocate for herself, and others, and like her husband and her family really had to almost threaten the healthcare system.
I think that's the point.
Weren't listening.
Yeah, I think that is the most insane part to me. I feel like you said, this is so important because a lot of women have a hard time really recognizing when they're having those intersectional experiences, especially like in the medical field. And I'm still learning. Luckily, I have parents and I have a family who tell me when something isn't right, and they're very educated on that. But I know that a lot of women don't have that privilege to be able to have that education and that knowledge of that. So I was always kind of thinking about what was happening with Black women, especially when they were just going to the emergency room, giving birth, all of that. And I'm always seeing Black people dying or coming close to dying because of that, and it feels like they're just never getting the help that they need, even though they're literally asking for help.
Right. And some of that is also just due to the fact that we need more other kind of providers like doulas. Doulas are great resources to support not just Black women, but everyone who are birthing people and seeking childbirth services in a hospital setting. We also need more options, even during this time of COVID-19. The hospital setting is not necessarily some people's first choice because of everything that's going on with the pandemic. And so therefore, there's been a high increase of people wanting to do home births, people wanting to go to the birthing center and work with a midwife. And so these are the type of work and type of policy and advocacy work that we do at Black Mamas Matter Alliance.
That's amazing. It's really, really inspiring. Sorry, next question. Yes. Black Mamas Matter works to center Black women and their families. Can you explain what that means in the terms of policies and practices that you're advocating for, and what needs to change to make sure that Black women can have healthy pregnancies and healthy babies?
Absolutely. From a policy perspective, as I said before, we work with many community-based organizations who provide direct services and programs to their communities as it relates to maternal and reproductive health. And so in particular, when it comes to policy, we really do push for, at the state level and at the federal level, for there to be more supportive policies that meets the needs of Black women, Black birthing persons, and their families. And so that looks like more so what we call in public health, really meeting the social determinants of health. So ensuring that people have the necessary transportation, housing support, employment support, and other social support services that are needed because it genuinely takes a village to raise a child. And so not, everybody's family situation is different. And so what we push for policy is that, one, we want to see more pregnancy accommodations, especially during this COVID-19 pandemic. We have seen that a lot of Black and Brown pregnant people have been considered or called into work and considered essential workers, whether they're working at the grocery store, still providing janitorial services. And so there needs to be more pregnancy accommodations for those people to make sure that they're able to actually take maternity or parental leave. So those are some of the policies we're pushing for. And then, as I mentioned before, we are really trying to get behind changing and seeing a shift around midwifery practice and services so that it's inclusive of community-based midwives and their traditional practices, both at the state level and the federal level. We really want to see entities like healthcare insurance and Medicaid being able to provide reimbursement to both doula services and midwifery services at a higher rate than what they've been doing before. So all of these things together actually helps Black women, their families, and all Black birthing persons.
I know that you touched on this a little bit before, but can you specify how has COVID impacted on the health of Black pregnant women and new mothers, and how has Black Mamas Matter responded?
Absolutely. So there has been a significant impact of this pandemic on the experiences of Black birthing people. I will say that one of the most unfortunate things that we saw happening in real time, especially throughout 2020, is the fact that Black women have been dying almost immediately after giving birth in the hospital setting because of plain out neglect. We saw that in the case of Amber Rose Isaacs and Sha'asia Washington. And so I named their names specifically because one of the things that we do is like around advocacy as Beam and May is that we feel like it's important that we say her name and make sure that we remember and put faces to the people that have been impacted by maternal mortality. The other thing is in talking about in general of what Black birthing people have been going through as a result of the pandemic is the fact that as they are trying to navigate, seeking healthcare services, especially at the height of the pandemic, one of the things that shocked a lot of people was just the changing policies that different hospitals had around who can be with you during the labor and delivering process. And, and we know that for a lot of new moms in particular, that could be a very challenging and scary time. So trying to navigate this system already is challenging, but then the fact that earlier on in the pandemic, a lot of hospitals were restricting doulas from even being able to support their clients. And as I mentioned before, for those folks who want to do home birth or birth at a birthing center, depending on the state that you're in, that may not even be an option. And
Right.
so as an alliance, we work at the policy level to really help to shift that and really look at systems change. What can be done at the state level to better amplify support policies that can create more birthing centers, or what should we be doing at the federal level to ask Congress for more appropriations to provide investments in building out the pipeline of creating more Black and Brown midwives?
Yeah, I think that two things. First, while the coronavirus was kind of at its peak, I had been writing a little bit more at home, writing my own stories to kind of produce because I have a production company. And specifically what I wanted to talk about was the Black Lives Matter movement that happened in 2020, just all of that had happened, and also specifically trying to change laws systematically, like straight from the government federally. And I feel like that is so important, to actually attack it at the source. And also backtracking to when you were talking about Say Her Name, my mother actually works for the African American Policy Forum. So that is their whole deal of saying her name. And I know that usually works with more police brutality with Black women, but it still has the same kind of feel with kind of saying her name and going at it systematically. So I love that.
And can I say something to that? I am so happy that your mom works with the African American Policy Forum. I want to say that a lot of the work that comes out of that policy forum, and also Dr. Kimberly Crenshaw, really informs a lot of the foundational reports and frameworks in which we do this work.
Exactly.
It comes. We are all about intersectionality, Black feminism, and so that's how that really does inform our work. So you are with great people.
Thank you. What are you hoping that policymakers will focus on in 2021 that will improve health outcomes for Black women? And are there easy wins that can make an immediate difference?
Yes, let's talk about those easy wins that can make an immediate difference. I am so proud to be in partnership with, through the Black Mamas Matter Alliance, to be in partnership with the Black Maternal Health Caucus. That has been led by and spearheaded by Congresswoman Alma Adams and Congresswoman Lauren Underwood, and at that time, Senator Kamala Harris, who is now our Vice President. They really helped to take a different approach in how they went about and engaging a multitude of stakeholders, but at the core, they ensured that they listened to and heard from Black women leaders in this work and advocates to really come up with what is now the Momnibus bill package. And so we believe in terms of 2021, what the federal government can do right now is to get behind the Momnibus Act right now. That act, I think it started off with having 9 pieces of bills. I think now it's at 11. And it touches everything from social determinants of health, even what I was mentioning before about expanding opportunities to build out midwives from Black and Brown communities.
Yeah.
There's a bill centered on perinatal workforce development. There's a bill around improving data collection. There's a bill around, yes, addressing issues around pregnancy and incarceration. I think that one was authored by Congresswoman Presley. You know, there's several bills within that act that can really hit this issue from a multitude of ways, both at the national level, but then also at the state level, because really it's through local level efforts, through the support of state and federal policy that's going to help really change a lot of these issues from a systems perspective, like you said, and really help for there to be real change that people can feel in real time, whether we're talking about healthcare systems, public health departments, and yeah, things of that nature. And so those are some of the immediate things that can happen in 2021 right now that can improve.
Yeah, issue. I love that. Another question: how can people watching this help to end this human rights crisis of preventable death of Black women? Just a suggestion, there are some beautiful collaborations with Milk, one of our favorite musicians that supports Black Mamas Matter. And if you're looking for a purchase that gives back, please visit the Little Market's website.
Yes. Some of the things that people can do right now, honestly, is to learn about the issue. I think this is a good point here for me to raise that Black Mamas Matter Alliance. Right now, we're gearing up for our 4th annual Black Maternal Health National Campaign. It's happening April 11th through the 17th. We're going to be, we along with several of our partners and other movement organizations, we're going to be amplifying a lot of this work and a lot of the issues and really digging deep into the history, how we got here, and ways in which the everyday person can be engaged during that time. So that's one way to get involved into like some of these national campaigns that are led by and speared by Black women themselves. Another way that the everyday person can just be involved is to support Black women-led organizations at the local level. You know, there may be organizations right now in your state, in your city, that's just doing really good work, whether they're supporting women and babies, or providing support services in general for families, providing the necessary resources needed to even address some of the emergencies right now, whether it's around COVID or what's happening right now in Texas, Oklahoma, and some of these other places that have been impacted by severe weather. You know, there are so many good people doing this work, Black-led organizations that are doing this work that really deserve just everyday donations and support to further sustain the work that they're doing. And then, of course, you can always visit our website at blackmamasmatter.org. Sign up for our newsletter. We're always sharing out different ways that people can be engaged.
Fantastic. I feel like that actually is really helpful for me, because I feel like the question that I'm always asking is, what can I do to help? What can I do to help? And I feel like it's also like the age difference of I'm so young, I can't do this and blah, blah, blah. So that helps me a lot. So thank you. Absolutely. Let me see. Last question. What gives you hope in your work, just to keep striving, to keep going? What gives you hope?
What gives me hope is really being supported by and working collaboratively, like I said, with a lot of the Black women-led organizations that do this work on a day-to-day basis, and also with our traditional midwives who will drive hours into like rural areas and provide services to individual families in need. And they do that with minimal resources. And so, really being able to help sustain our organization, doing what's necessary to work in the area of policy and research to amplify this best practice, evidence based practices that these folks are doing is what really gives me hope, because we can see in real time, honestly, how then the work that we do translates into actual policy change and systems change that then transforms how folks who do this work on the everyday basis are able to do the work that they do, are able to receive resources and investments so that they're not burned out. They're able to provide more opportunities and employment services, right, for other folks, especially for young folks who are interested in becoming a healer, a midwife, or anyone who's interested in maternal and child health, you know. And so really doing this work around policy and research and amplifying the work that we do through our Black Maternal Health Week campaign. And I should mention that we also have our Black Maternal Health virtual conference coming up at April 16th and 17th that really showcases in real time this work. That's what gives me hope.
That's incredible. Well, Angela, I had the best time talking to you. It was so informative, so descriptive, and you did an incredible job. I feel very, very, very inspired today just to be able to have this chat with you. And now I get to use this in my daily life, and I get to use this going forward. And I feel like this is great inspiration just for me as a creative and as a writer and as a Black woman, and me just having Black women around me, having a Black family, always having my mother and my sister around me. I feel like this is really, really inspiring for me. So thank you from the bottom of my heart.
Thank you. Thank you. And I'm just excited that to even have this opportunity and to even be talking with you. You know, I absolutely love that you are a writer and that you're even engaged in these issues and topics, even at your age. Just know that a lot of us started at a very young age doing advocacy work and writing. And so I just encourage you to keep going. We need your voice. We need your presence.
Thank you.
We need your work. Yeah.
Thank you so much.